The GBI Medical Examiner's Office provides complete forensic pathology services to 152 of Georgia's 159 counties. Deaths that fall within the guidelines outlined in the Georgia Death Investigation Act are reported to medical examiner investigators by coroners, law enforcement, and hospital personnel. The decision to perform an examination is at the sole discretion of the medical examiner. The GBI Medical Examiner's Office is located at GBI headquarters in Decatur, Georgia. In addition, there are satellite medical examiner's offices in Augusta, Macon, and Savannah. All deaths fall into one of 5 categories, classified as manners of death. These categories are homicide, suicide, accident, natural, and undetermined. Medical examiner staff work closely with law enforcement and coroner staff to determine the cause and manner of death based on the autopsy findings, the decedent's medical and social history, and the scene investigation. An autopsy is the dissection of a decedent to determine the cause of death and document injuries that may have caused or contributed to the death. Pathology assistants perform multiple dissections under the medical examiner's supervision in an attempt to locate the cause of death. Blood, urine, and vitreous fluid, a clear fluid surrounding the eyes, are drawn from the body and sent to other sections of the crime lab for analysis. Trace evidence, sexual assault kits, and gunshot residue kits can be obtained and sent for analysis also. In suspicious cases, the decedent's hands should be bagged on scene in clean paper bags to preserve any potential evidence. Every deceased individual is photographed and his or her personal belongings are cataloged for release to the funeral home after the examination is complete. Fingerprints are obtained from unidentified individuals and from all homicide cases. The most common method of identification is a visual ID. The decedent is compared to his or her existing photo identification. Identification methods are scientific. A circumstantial identification is not acceptable. Fingerprints and dental records are often used if the decedent is decomposed or burned beyond recognition. DNA typing for identification purposes is employed as a last resort due to the costly and lengthy nature of the process.